Hello, and welcome to another episode of Yummy Data Science. Today's episode is going to be talking about ICD 10 diagnosis codes. This is a key healthcare code set. You cannot work in healthcare without knowing about ICD diagnosis codes. So, ICD stands for the International Classification of Diseases. It was created, designed, and maintained by the World Health Organization. We are currently on version 11. It's a global standard for diagnostic health information, for reporting on mortality, etc. Now, the US has its own version, and we are on version 10. So, version 10 is the current US version, and that is maintained by the Center for Medicare and Medicaid Studies, CMS, and that's what I am going to be talking about. Version 11, which is prevalent in other countries other than the US, is dramatically different than our version. So, a reminder that this is about the US version. But first of all, why is ICD so important? Well, because we need a common language. We need a common language in order to report on our data, in order to monitor disease, in order to say, okay, is this diabetes or is this not diabetes? And we need that in order to be able to share data and share data analysis. So who uses the ICD? So anybody associated with healthcare, physicians, nurses, they're also coders, people who do medical coding, researchers, health information, IT organizations. So if you are interested in healthcare and are interested in healthcare data, then this is something that you should definitely learn about. So most countries use the system, and it has been translated into 43 languages. So I've seen many different versions of ICD, and when it's a script I cannot understand, I know it's another language. So what is it useful for? Well, ICDs are really the gold standard for determining whether a cohort has a particular disease. So that stepping back, what is a cohort and why is that important? Well, cohort in terms of research and medicine is a group of individuals who share a common characteristic within a defined period. So, for example, a group of individuals who have diabetes within, say, 2024 and 2025. And once we define a cohort, say, the people who have diabetes in those 2 years, then we can determine what their treatments are, on, and we can compare it and we can get to efficacy and effectiveness of treatment. That's the main idea behind cohort definitions. However, the example that I'm giving is very, very simplistic. Cohort definitions can be very extensive. And obviously, ICD diagnosis codes are critical elements of defining disease cohorts. And you may have rules such as, so if you are getting your code from an inpatient claim, yes, that counts as a disease marker. If you're getting at least 2 claims from professional or doctor's visits, then that counts. So you might have different rules like that. And I've mentioned before that ICD is considered a gold standard for determining a disease, whether a person has a disease or not. But if that's not available, and there are many cases in which that may be true, then cohorts may be defined based on what procedures the patient is getting or what medication the person is getting. And the procedure codes are generally captured by HCPCS codes, and that's another whole area which I'll cover later. And medication and treatments are generally denoted by RX, prescriptions. So let me talk a little bit, and I will keep extending the diabetes example. And I want to talk about the organization of ICD diagnosis codes. So it's actually a big book, ICD version 10. And it has 22 chapters that are created according to body system or the type of disease. So, for example, chapter 1 that has the codes A00 to B99 is certain infections and parasitic diseases. I was researching something the other day, and by the way, cholera falls under the chapter 1. Now, chapter 2, C00 to D49, that's neoplasms. We think of neoplasms as cancers. And chapter 4, E00 to E89, is the endocrine, nutritional, and metabolic disease. And you know the diabetes, and we know that diabetes falls under that, chapter 4. Chapters can then be further broken down into subchapters or blocks. So, for example, chapter 4 can be broken down into the following list, and it's not exhaustive. So, diseases of the thyroid gland, diabetes, mellitus, forgive me if I'm saying this wrong, and so on. So, E08 to E13 is diabetes. So, let's now decompose an ICD diagnosis code. The minimum length of a valid ICD diagnosis code is 3. So E08, E13. Okay. The maximum length is 7. And the decimal place after the third character, but organizations sometimes will remove the decimal place from their databases. So it will read like E0800, something like that. So the first character is always A through Z, except U. And then the second character is 0 to 9. And the subsequent characters are either A to Z or 0 to 9. And the characters after the decimal place give you information regarding the anatomic site, which part of the body is it coming from, what the severity is, or underlying conditions that the disease is coming from. So, for example, E08.22 is diabetes due to an underlying condition with disease. Kidney failure and kidney disease can lead to diabetes. Or it might be actually vice versa. I don't know. So forgive me if I misspoke. Then the next code, and this is the most detailed one, E08.3233. So the last character is called an extension. And that extension, if you look at the description here and you'll see a comma, it's bilateral. It has something to do with an eye condition, retinopathy with macular edema, and it's bilateral. So it's in both eyes. So the 7th character is an extension of the ICD code. So this video concludes with a description of the ICD system. I hope you've enjoyed it.